Good afternoon, and welcome to our Corporate Huddle. My name is Renee Sweeney, and I'm a communication consultant within St. Joseph's Communication and Public Affairs Department, and I will be your moderator for today's program. Our agenda today is focused on one of the key foundational principles that is woven throughout our strategic plan, care partnership, and the importance of engaging patients, residents, and family partners across our organization. We thought this week would be a fitting time to talk about care partnership because yesterday was National Carers Day, an occasion that recognizes and celebrates the more than 7.8 million caregivers who provide support to people with health conditions in Canada each year. We have several speakers with us today, including, of course, our President and CEO, Roy Butler, who will lead the discussion on care partnership as it relates to our strategic plan. We are also very fortunate to have care partner Wendy Heel joining us this afternoon, who will share her experience as both a St. Joseph's patient and a care partner. We also have our Chief Communications Officer and Director of the Care Partnership Office, Patricia Hoffer, with us, as well as St. Joseph's Care Partnership Office Coordinator, Jennifer Hall, who will discuss our role in getting accreditation ready, as well as how we partner with patients, residents, and caregivers. Throughout the presentation, you will see that we have included opportunities for real-time audience participation through a number of poll questions that will pop up directly on your screen. We will also have an open question and answer period at the end of the program. You are welcome to post a question at any time throughout the huddle using the Q&A feature, but just know we will hold off answering any questions until the end. We've also received a number of great questions from staff in advance, so please note we may not be able to get to every question at the end of the huddle today, but we will follow up directly with those whose questions did not get addressed. However, we will not be able to follow up if your question is asked anonymously. Without further ado, I will now pass it over to our President and CEO, Roy Butler.
Thanks, Renee. I'll just do a sound check. Can you hear me okay? Getting the thumbs up. All right. Good afternoon. Thank you, everyone, for joining the Corporate Huddle today. Partnering with patients, residents, and family caregivers is really a foundational principle at St. Joseph's. It's essential for us to fulfill our mission, to achieve our vision of earning complete confidence in the care we provide. It's a way we strengthen how we live our values of respect, excellence, and compassion, and critical to attaining our strategic priorities. Our ultimate goal at St. Joseph's is really to have care partnership embedded with patients, residents, and caregivers at multiple levels of the organization and in a wide variety of ways. And today you're going to hear some examples of that. You're going to hear about how we had our care partners involved in co-designing of care processes, participating in research and policy development, and the governance of the organization, involved in leader hiring panels, and also care partners that are positioned to contribute to our patient, family, and resident councils across all of our sites. Through this is a thread of just the power of care partners and sharing their experience and bringing their voice and lens to all we do and how that enriches and strengthens all that we do. So I can say that from personal experience over my years here, and I've also seen that in various departments and programs across our organization. If we go to the next slide, let me just clarify, what do we mean by care partner? So really, care partner is a term we're using for any person who has recently been or is a current patient or resident at St. Joseph's, and or somebody they've identified as a key family member, a partner, a friend, in their care. And these are individuals who have put their hand up to say, I'm willing to share my time, my experience, my voice, to shape and strengthen how we move forward as an organization, and not just care, but also in teaching and research. And we really believe that those voices will do nothing more than enhance our quality, our patient outcomes, by having them at the center of all of our change. So I'll turn it back to Renee.
Thanks, Roy. At St. Joseph's, we're always interested in hearing from our staff and physician. And so, as promised, here's our first real-time poll question for today's huddle. Please note that the poll is anonymous, so your name will not be attached to your responses. First question, how do you see care partners adding value at St. Joseph's? So you'll see several multiple choice options pop up on your screen. Please select your top 3 answers from care design, space design, governance, advocacy, or quality improvement. I'll give you a couple more seconds to enter your response. Looks like the leading answer is quality of improvement, followed closely behind by care design. And then advocacy is the final, is the third highest response. Cool. Okay. So now I'm honored to introduce our next presenter, who is a passionate storyteller, performer, patient advocate, blogger, and a St. Joseph's Care partner, Wendy Heel. Wendy has graciously agreed to share her time and expertise with us today regarding her lived experience as a patient in St. Joseph's post-COVID-19 clinic, as well as her perspective as a care partner. Just remind you to take yourself off mute, Wendy, sorry.
Thanks everyone for coming, and thank you for asking me to do this. The slide that you see on the screen here is a piece of artwork by Nicoletta Baumeister, who's a formidable artist, and it's titled Pattern Series 16. Now, the artist has been focusing her work on perception and its role in how our brains perceive reality. And this is what she writes. I feel the visual discordancy echoes the challenge the brain confronts when sifting for sense in the barrage of familiar and foreign imagery and information that arrives daily, disembodied by media formatting, divorced from context, made alien by imprecise language, often under heightened time constraint. A friend wrote, "This painting is a great description of what brain fog feels like." I am the friend that wrote that last comment. I've tried to explain what brain fog is like and have felt really unable to describe it, and she does it so succinctly. Now, my fight with the dragon began in December of 2020, and the dragon is how I refer to COVID. I'm now at 2 years and 3 months since my first case of COVID, and I'm what they call a long hauler. That's how I became a patient of St. Joseph's as part of the post-COVID-19 clinic. Since the dragon and I have battled, I have had to adjust so many things to be able to have anything close to a normal life. COVID rules everything. And despite all my efforts, I caught COVID for a second time last month. Just imagine my delights. I had reached a point where I was managing my remaining symptoms well, I thought. I have to limit and organize my activities, both physical and mental. My remaining issues are fatigue, brain fog, word finding difficulties, but my hair has grown back, so that's a positive thing. The past year, I found that I cannot take notes at meetings and think or form questions at the same time. I had worked my way up to walking 5 kilometers every day in January. Full disclosure, I spent 3 weeks in Grand Cayman while I was doing this. I don't do cold. After COVID 2.0, I had to reset. I went back to walking up and down stairs in my home, 2 up, 2 down, which is when I start to huff and puff. And I again have to rest in the afternoon, and sometimes it's sleeping for 2 hours. The brain fog has returned to a level of about 6 months ago. Trying to explain what that feels like is difficult for me. And it resembles my sewing box after it's been knocked to the floor. A jumble of pins and needles and buttons all mixed in with loosening spools of thread and bits of fabric that I cannot make sense of. And my brain wants to find the end of a piece of thread that will pull it all together and provide sense of the chaos. After my first infection, I started a blog about my COVID journey with 2 goals. Firstly, to describe what it really felt like to have COVID and what we were trying to avoid. And secondly, to talk about the effect that COVID has on those in the healthcare field, the stress and the burnout. I still feel the pull to communicate on both levels. However, now there is a third pull, which is to make a difference at a higher level. within the healthcare system. And that's how I started my journey as a care partner at St. Joseph's, and why I still feel the need to tell my story. Because despite the passage of almost 3 years of COVID in this country, people still do not have a full understanding of what this illness can do. And because of this lack of understanding, our society is still not honoring or encouraging or helping our frontline workers, those in the hospital setting, those doing home care, those working in clinics, for example. I remember the feeling of being useless in the hospital, but the kindness, the gentleness of those handling my weak, incapable body was like a velvet textured flow of love and trust that continues to envelop me. It urges me to try to help, to try to get people to understand how this dragon has changed everything. It's very important to have a proper diagnosis and to provide the earliest access to rehab, but that is a problem. We are now doing RAT, or rapid antigen testing, in our homes, if at all. We are all still trying to treat ourselves at home, rest and fluids, etc., just like we were told at the very beginning. But not many are talking about those who may be affected by long COVID. Studies show that there could be numbers as high as 1 in 5 patients who may be long haulers. Hardly anyone wearing masks anymore. I started my blog to spread information at the beginning to my friends and family while I was in the hospital. And now I still feel the need to talk about my life, but at a different level. And my interaction with the Care Partnership Office has been stellar, nothing less than stellar. I was asked by my OT and PT and SLP if I might be interested in joining this organizational effort. And at first I couldn't imagine what I would do to help. You know, there's not a long line of letters after my name. I was told that lived experience has value, that I was an expert about how it felt to be a patient, and I understand that now. This opportunity has been amazing. When my doctor first told me that LHSC was looking to do an article for their hospital newsletter on a COVID patient and would I consider talking to them, I jumped at the chance. And then my respirologist at St. Joe's asked if I would agree to an interview. After all, my blog has only limited reach because I was concerned about privacy issues. I only had about 150 subscribers and maybe another 100 regulars helping me to spread the word. I did a couple of free press interviews, but what grew from that is still incredible to me. I did 2 stories in print for St. Joseph's. I did interviews for print, radio, and TV. I've been asked to do workshops with students from Western, future rehab staff, and doctors. I was asked to speak at 2 separate forums recently for the Lung Health Foundation. I became a member of 2 committees with Ontario Health. I have been able to share information on emerging studies, helping people to understand some of the work progressing on COVID. This effort comes about with the participation, the energy, the encouragement of the CPO that all care partners receive. When I think of how we can open up lines of communication with the Care Partnership Office and Communications Office, and with the care partners, all of them, the mind boggles. We've been working on ideas to recruit and retain care partners. I see this as bottom up rather than top down. There's a huge pool of expertise that could be tapped. So many different talents to be used to the best advantage. New programs may be developed for other clinics. We can recruit and retain our patients and caregivers. We can spread the work around, making the end result clearer, more defined, more accessible. Let's work together to make things better. Care Partnership Office, Communications Office, and volunteers, and now corporate leaders and staff. We could be an unstoppable force, in my opinion. Thank you very much for listening.
Thank you so much, Wendy. Whoops, give me a second to get back to where we're going here. Sorry about that. Listening to a care partner share their insights is extremely valuable, and I think our staff and physicians would agree that it's a testament to how those with lived experience have a wealth of knowledge, just like you said, Wendy, and we can learn from that. With that in mind, it's time for our next poll question. For this one, Please enter one word that describes how listening to Wendy's story made you feel. This will create a word cloud based on your responses. You'll note that words appear bigger as people are entering their responses the more often they are mentioned. And I think it's interesting that the largest word by far there is inspired, which I think is, again, a testament to your story and to the wealth of knowledge that you can share with all of us and other care partners as well. Give it a couple more minutes here, a couple more seconds. Okay, thank you for sharing your thoughts and participating in that question. I'd now like to welcome St. Joseph's Chief Communications Officer, Patricia Hoffer, who is also the executive lead of the Care Partnership Office. She's going to speak to the role of the Care Partnership Office and of each of us in partnering with patients, residents, and caregivers at St. Joseph's.
Thanks very much, Renee, and good afternoon, everybody. Wendy, thank you so much for sharing your story. I've heard it a couple times now, but it's always poignant, it's always touching, it always grounds us and reinforces us, reinforces our goal and our foundational principle in this area. So thank you for that, and thank you for the gift of your time and your expertise as a care partner. We are very grateful for all the care partners who have committed to sharing their experiences and their lived experience and their voice. Roy talked about this. They are powerful resources that will strengthen not only our organization, but the healthcare system overall. And Wendy provided some great examples of the work that she's doing outside of our organization that is really contributing to that. So what do you need to know about the Care Partnership Office? Well, first of all, it's a small but very mighty team with Jennifer Hall as coordinator, who you'll hear from shortly, and two consultants, Mariam Alzanem and Stephen Slauka, who I know are out there somewhere. I think they're facilitating some of the in-person rooms that we've set up for today's huddle. So our team serves as a bridge between our patient and family partners and our clinical and support services teams. We facilitate and connect care partners like Wendy to programs and initiatives where there are opportunities for input and engagement. A key role is the recruitment of patient and family partners, and Wendy talked about this as well. We work with our partners to design what that looks like, and really it's about building relationships, supporting their needs, and sustaining their involvement in opportunities across the organization. Another important component of our work is the training and education of our staff, physicians, and leaders. Our goal there is to really have everyone embrace, understand, and respect the value and impact of including care partners in our work. We also want to make sure that you have the tools and the resources to support and engage our care partners in meaningful ways. How to recognize when a patient or family member might have the interest and capacity to serve to become a care partner. And Wendy mentioned being approached by her care team. And this is a real testament to how important it is that we do this work together. The Care Partnership Office is really just a catalyst and a conduit and a really great resource for the when and the how. And last but not least, our team continuously seeks out new knowledge on best practice from peer organizations and thought leaders to help inform our work and inform how we can be part of a community of practice, build our own community of practice that ensures we're nurturing this work and responding to the needs of the organization and our care partners. And there's so much opportunity for us to be thought leaders in this space as well. Next slide, please. So this is really, as you know, this is not new work for our organization. We have a really long-standing history through our patient, family, and residence councils and other opportunities that have occurred over the years of using the lived experience and the voices of those we care for in driving change and advancing how we deliver care and design. The Care Partnership philosophy formalizes that, what is already intrinsic to our work. And now it's about making sure every encounter is approached with a partnership lens and that we're using best practice to enhance our efforts. As staff, physicians, and leaders, you are the key to ensuring that we're able to recruit, engage, and embed care partners in our work. It's in our strategic plan, and we're well positioned to be a leader in this space. And with accreditation in the fall, we have an opportunity to really showcase and shine a spotlight on all the great work that we're all doing with care partners at the table. Next slide, please, Renee. So speaking of accreditation, there's at least one subsection, one clause, criteria, or guideline that relates to engagement with patients and families. And why is it so front and center? Well, the aim is to continue to focus not only on a person-centered care approach, but on a person-centered system approach as well. And so what does that look like? As I mentioned before, it means leveraging the lived experience and the voices of our patients and families to shape healthcare at the organizational level, the program service level, and at the direct care level. So when Accreditation Canada is here in the fall, we're confident they will see evidence of that across the board, and that you as staff and physicians will be prepared and ready to answer questions from the surveyors about person-centered care and how we engage and partner with our residents, caregivers, and patients. So back over to you, Renee.
Thanks, Patricia. So building on what Patricia was just sharing, we would like to get some more feedback from our viewers. This time, we'd like to know what your thoughts are on what our teams see as their role in care partnership. So for this poll question, please choose what you feel is the most appropriate answer on your screen. From recruit patients and caregivers to become care partners, provide person-centered care, facilitate opportunities for building a person-centered system, involve patients in care decisions, or all of the above. So it looks like the overwhelming majority would agree that all four of those responses are extremely important across the board. Well done. Okay. Next, we have a short video to share with you, which provides information on the kind of work that care partners are currently being engaged in at St. Joseph's. After the video, Jennifer Hall, coordinator of the Care Partnership Office, will share specific examples of some of the projects that care partners are participating in across our organization. Over to you, Jennifer.
Thanks, Renee. As the video explained, our care partners have had the opportunity to engage with research and quality improvement projects and various committees, but we also have processes in place for care partners to be a part of any one of our 7 patient and family advisory councils, leadership hiring panels, including Roy. He had a care partner on his hiring panel, storytelling opportunities, which Wendy has talked about. We've been so grateful to be able to speak to college and university students about their impact coming into the healthcare field, about acknowledging the lived experience of our patients and what that can do for their future careers. And of course, initiatives external to the organization. We get calls quite frequently from people outside saying, you know, I need someone with lived experience. How can you help me to match with someone and help me with this project? So we support external to our organization as well as part of our duty to support our external community too in this mission. We also, since the office was established in November of 2020, we have recruited and onboarded 110 care partners who have contributed 859 hours of service to our organization. And those hours are from what we captured in 2022. This number is just a snapshot and does not reflect every circumstance where care partners, patients, families have contributed their lived experience, their voice, their talent. Those hours are care partners of what they have reported to us that they have done, whether that's meetings, hiring panels, research on their own. So we also track the time that they are spending trying to understand medical jargon and reading minutes before even attending the meeting. And it's a significant contribution that's helped us in how we develop, deliver, experience, and evaluate our care together. I also want to acknowledge these 110 care partners for being the first few to trust us and be vulnerable with their stories and take that leap of faith as we've matched them to teams and committees who were just learning and growing alongside of us. If you haven't worked with a care partner yet, and you're hearing from Roy how embedding lived experience is foundational to the strategic plan and that it's work that we need to be doing every day, and you're hearing from Patricia that it's a part of accreditation, and they're going to ask you, how do you infuse patient and family caregiver voices? And maybe that feels very heavy and daunting, but I want you to know, and you might not know, how to start or excel, and that's why the Care Partnership Office is here. So we're here to support you and guide you anywhere that you are along this journey. So next slide, Renee. So there's a few pathways that you could get started with partnership depending on where you're starting from. If you are starting from scratch and this is the first time you've even heard the term care partnership and attending this, you were like, I wonder what that's all about. Call us, or you can look us up on the internet, Care Partnership, and you can see we have an intake form, or you can access our telephone or email. Give us a shout. Just have a conversation with us, discuss your ideas for engagement, and reach out to our team. You also want to check in with yourself and your team and start asking yourself some questions. What do you need to know to make this a success? And what are your fears and your hesitations? We can offer team education on care partnership to prepare for the engagement and create a safe environment for everyone involved. Next, you also want to map out your engagement plan. What does the care partner need to know, and what will they be asked to do? What is the aim of the work? What is the time commitment? And how will you be providing feedback on how it will be meaningful for everyone involved? Our team can help you answer those questions, and we also have resources to guide you through each stage of that engagement. Once you're organized, our team will reach out to our roster of care partners and find a match. If you had specific requests for people you are looking for, we will help create a short list of folks who might be able to suit your project best. Care partners then consider the opportunity, and if there's interest, we will connect to that person making the request with a warm introduction from us. Sometimes the people we have in our roster don't fit your needs of what you're looking for. For example, if we don't have a person who's been involved with your program or service. There, we will work with you on a recruitment plan that's internal to your team or project to find care partners. The OSI project that Omer spoke to in the video was a perfect example with that. From a combined effort with OSI, with Care Partnership, we developed a recruitment plan that included a tailored personal ask from clinicians that spoke to what they were doing and hoping for and what it was needed. I also want to give kudos to Omar because he's now created that as an always event in monthly meetings. Patients from his service who are now being discharged, he reminds clinicians to do that ask, are they ready to be a care partner once they're being exited from their service? We have heard from so many of our care partners that it was that personal ask from the person that they trust to encourage them to reach out and connect with us, or to have their clinician give permission to us to contact them. From there, we just have a chat about interest. We start to build a relationship and we answer any questions that they might have. We also need your support in building this network. We acknowledge and celebrate that teams and programs have worked alongside patients and families for quality improvement long before we were established. So we're asking that teams and programs who are already working with patients and families who could be potential care partners and want to be linked through other opportunities that we have, other education, if it would be okay for us to have their contact information about the Care Partnership Office just to get started. The incentive to join our roster is consistency for the organization and for care partners, that they receive the same experience no matter what program or service they're connected to. We also make sure that those with lived experience have access to consistent and comprehensive orientation, education, networking, and continual engagement from us. Every new care partner, as I mentioned, is provided that standardized and comprehensive orientation. This was a gap in our 2019 accreditation survey, but now all existing and new care partners, including all members of our patient and family advisory councils, start with the same information about care partnership, privacy and confidentiality, infection control, civility in the workplace, and using their voice to share their lived experience. Lastly is evaluation. We ensure that we are qualitatively and quantitatively evaluating our organization's engagement environment, the connection between teams and care partners, and the effectiveness of our office. Our care partners have told us that the feedback loop and knowing how their voice makes an impact is what keeps them engaged. So this evaluation piece is a way of us committing to excellence of the organization, as well as to the care partners we support. So talking about evaluation, we just want to see, what is your current comfort level? So we're going to pop up a poll and we want to know your thoughts. How comfortable do you feel engaging with a care partner in your work? So please use the poll, and we're going to give you a couple seconds to give your answer. And again, that's what we're here for. If you were someone who voted a 2, we can get you started. If you were someone who voted a 1, that's what we're here for. And even if you are a 4 or 5 and we're learning new and best research and practices all the time, we can guide you anywhere along the journey. So thank you for your honesty and providing the information from that poll. We're now going into another video about what can you expect when you work with us.
Thanks, Jennifer. Okay, so we're about to jump to our Q&A section of the program, but lastly, I just wanted you to take note of the contact information for St. Joseph's Care Partnership Office. And this contact information can also be found on the intranet should you need it at a later date. We'll now open the floor for questions. Please use the Q&A feature here to submit your question. However, please note, as mentioned earlier, we may not be able to get to every question. And if that's the case, we will follow up directly after the huddle with anyone who whose question didn't get addressed. But just remember that if you ask your question anonymously, we won't be able to follow up. Okay, I'm just going to shut down the presentation while we get started with the questions. Okay. Okay, the first question looks like it's for Wendy. Wendy, what is something we could do to ensure care partners are always provided a supported and meaningful experience? Just a reminder to unmute for the presenters to unmute before you answer.
Thank you for that reminder. If I could give some advice, I would say feedback. I really need to know what participants feel about any presentations I offer. Did they learn anything? Was there any value? And what happened after? Did my input contribute in any way? This is about respect, really. Volunteers offer their time in preparation, meetings, research opportunities. And then when we do not hear about outcomes, it feels like there's no recognition or value. Feedback also provides us with the tools we need to improve our communications, to provide clearer stories, thoughtful stories, and allows us to tailor our input to what a request is hoping to achieve. So, you know, I say, let me help you in your endeavors, and then you help me to improve. It's a win-win situation. You know, don't waste your time or mine. Encouragement is a two-way street in this regard. The work improves, and sometimes it changes direction. Thanks.
Thank you, Wendy. The next question I'm going to send over to Roy. Are there any patients or care partners on St. Joseph's Board of Directors?
Yes, great question. So we do have care partners sitting at the board. They also sit on the quality committee of the board. And we have care partners in some of our internal leadership committees as well, like Quality Council as an example.
Thank you. And the next one is for you as well. During the accreditation survey in October, will there be a patient surveyor on site?
There will be. So we actually, our last accreditation survey, we were one of the early adopters of having a patient surveyor join, and we put our hand up and did that willingly while Accreditation Canada was kind of starting this program on having care partners and patients as surveyors. So absolutely, in October, we'll have a patient surveyor again. They'll be a full member of the survey team, sometimes with an accreditation survey, and sometimes they'll be on their own as well. And we'll be looking for, you know, how that partnership lens and our patients and residents and family caregiver lens is incorporated into all we do. We also have 4 or 5 care partners at St. Joseph's who are participating in our tracers and completing tracers in terms of our preparation for October as well.
Great, thank you. Another accreditation question. I'm going to flip this one over to Patricia. The question is, in regards to patient and family engagement, what will we need to know for accreditation surveyors?
Okay, thanks, Renee. Really, we'll need to know, how do you engage? You know, they'll ask questions like, how do you engage patients, family caregivers, residents, clients in your work, in quality improvement initiatives, in review of policies. Where do we go to find patient family care partners to partner? How do you involve them in care planning? They might ask for an example of how you've implemented a quality improvement initiative based on patient feedback.
Thank you. Another question, I'm thinking this could either be Jennifer or Patricia. Does this framework include patient counsel?
I can take it. So with the establishment of a care partnership, what ended up happening, because we already had 7 patient and family advisory councils, and their work already was inspiring to build out and build more opportunities for lived experience to have places to go throughout our organization. So what has happened is care partnership is the umbrella, and councils are one opportunity where care partners can contribute. So that's how we support the members at the table of council. We don't do any council oversight. We don't direct them and tell them what to do. We support the members at the table to have resources, education, connection, and other opportunities outside of council walls.
Thank you. I have another one for you, Wendy. Important question. How do we know if we're asking too much of a care partner?
Yeah, that's really important. A care partner needs information at the beginning, the middle, and the end of the engagement. The care partners need to be able to open up and to trust the people they're working with in order to address their own vulnerability. It takes a certain strength to be able to tell your story to a room full of strangers. So I say to people, be honest, speak English, not jargon, and ask if they need any support in any aspect of their work with you. I mean, trust is essential, and it starts with the CPO, really, but it must extend through the working relationship from the request or of the request. It is a partnership, after all. If the original engagement was for 3 or 4 meetings, and now there's a possibility that it may extend for months or years or, a lifetime, ask how they can be impacted. Can you make it easier? What time will they be able to devote to this? Do they have any suggestions on how to improve that? I mean, as an example, when I work with anyone, I ask for the slides and the notes prior to a meeting because my brain doesn't work as fast as my tongue and vice versa, and I might trip over things, and I have trouble taking notes. So when I receive those things earlier, I can form an understanding before I even get into the discussion, and that makes it easier for me. So trust. And I will say, I'll take this chance to say that the 3 people I've worked with, Jennifer, Stephen, and Miriam in the Care Partnership Office, are some of my best buds now. They really understand me. They jump in and provide information and requests for, I don't even have to ask for anything anymore. I arrive and it's there like a smorgasbord in front of me. So thanks, you guys.
Great, thanks, Wendy. Roy, another one for you. How are we contributing to thought leadership as it relates to care partners?
Okay, I'll have a first go, and then Jennifer, if I miss something, you'll jump in and close the gap for me. So I know the Care Partnership Office has been involved, for example, in the London, Ontario Health Team. So bringing expertise around co-design of like care pathways for some of the priority populations like COPD, CHF. They're at the table with OHA, with the Ontario Caregivers Association communities. So bringing that expertise there. And Jennifer, I know there's been a request to the office from organizations and agencies kind of in the surrounding community to bring expertise to the table. And paramedicine and Oxford County, we're looking at how do we kind of co-design our strategies with the homeless population. And so it was, the strategies and the process for how to do that was something that Jennifer and her team were sharing expertise in. But Jennifer, I don't know if there's anything to add to that. Jump in.
Yeah, so thanks for that, Roy, and you got it. So the Oxford Paramedicine reach out is a great example of, we get requests quite often from organizations and community health organizations that don't have their own internal engagement, and they're just looking for the how do you get started, what do you do? And that's similar to if you came to us, any of the teams that are listening came to us for a consult. We don't have the bandwidth or the ability to do complete consults with outside organizations, but we're using our ability to give them tools and resources to get started on their journey, give them food for thought, and give them direction and support. So yeah, when the community paramedicine program said that they wanted to be able to engage with their homeless population to improve their community medicine program, of course we said, yeah, we'll have a chat with you. And we do that with a variety of outside folks. So yeah, just adding to that thought leadership, that we're being tapped and saying, how are you doing what you're doing? Even the expansion of going from many organizations, traditionally through advocacy, councils came first. It was a venue for patients and families to use their lived experience in an established way in a healthcare organization. And now we've taken that and blown it up and brought so many opportunities. And many people are coming to us and saying, how are you doing that? How are you embedding this throughout the organization? A lot of it comes from that we have support from our senior leadership to really start to embed and push the needle every day on what we are capable of in terms of infusing where care partnership can live within our organization, and being open to, our progressive thought about that. And so that's also where we're seeing change happen through how we're providing education, how we're bringing in lived experiences of people from unique circumstances, or, taking that EDIB framework to bringing in care partners from a variety of backgrounds. And also our evaluation methods, those kind of key pillars are how it's making us exceptional, unique, and being tapped to answer more. I think I went off topic and tangent, but thank you, Roy. Flipping it over to me.
It's too bad you're not passionate about this work.
I was just going to say the same thing. Wendy, one more for you. What would you say, based on your experience as a patient and as a caregiver or care partner, what is one thing St. Joseph's could do to improve care for COVID patients?
Oh, great. This is near and dear to my heart. It's my intention. Sharing education and information. So think about it. How does the general public learn about the post-COVID rehab clinics if they don't have a GP? How do they know that they have long COVID? There's over 200 possible symptoms listed that have been observed in COVID patients, and they don't happen at the same time, and they vary from one person to the next. Some begin at the onset of COVID infection, some happens months later. Some appear for a few days and then recede, only to recur again in the following months. It's complicated, and not all GPs are up to date, and the information changes often. So the benefits of early intervention are obvious and recommended. But one thing that's very important to a patient is the support, the reassurance that you're not losing your mind. There is something wrong. And there is hope offered when meeting with a team of rehab and medical professionals. And I mean team. I mean people who communicate with each other, share information in your treatment so everyone knows your condition and they can collaborate and explain about the direction of your treatment. But the things that make all this possible require the spread of information. So telling patients and caregivers where to go to find information about the COVID clinics, information pamphlets given to patients and caregivers at the beginning and at the end of their interactions, so that there's education and support at the very same time. It is crucial to let people know that, yes, this is what you might have. Yes, there's a way that we can help you. Thanks for that question. That was good.
Thank you for your answer. Okay, Roy and maybe Patricia, you may have something to add to this as well. Here's another question. There are a lot of healthcare organizations creating councils and networks. Any thoughts on how organizations in the Middlesex London area can partner together to build regional patient caregiver networks for bigger impact?
Yeah, thanks. I'll kick it off and then happy to hear as well. I think one avenue is through the work as it continues to evolve in the Middlesex London OHT, and there is a care partnership engagement there that brings multiple perspectives to the table, and care partner that co-chairs the coordinating council for that as well. So I'm going to forget the name, but I think it's Patient and Family Advisory Council for the Middlesex London OHT. And we've also done some of that. I saw Aaron Watson on one of the videos, and it made me think of the community advisory group and some of the care partners that we've had across the various agencies as well that we're supporting in that frail senior work, and the ability to tap in to multiple voices along the journey for our frail seniors in our community, not just within the hospital setting. That's off the top of my head, but Patricia, anything you want to add to that?
The other one that I'll add is through the Mount Hope Family Patient Family Council. They, I think, based on their experience of being part of our council co-chairs coming together and sharing information, they've asked for our support facilitating a network of long-term care home family councils. And so we've been providing, I know Jennifer and the team have been providing some guidance to them as well. So there's certainly an appetite for councils to come together that have sort of similar patient populations or similar interests. So I do think that we can serve as a conduit in terms of providing resources and expertise, and then participating as well where it's appropriate.
Thank you. Jennifer, are there specific types of people you are looking for to be a care partner?
That's a great question. Going back to Roy's definition that we really want to ingrain back to the organization of what is a care partner. It's anyone who's had lived experience of receiving or supporting someone who's receiving care. And so we're looking for people with a variety of experiences. I will admit, our 110, we don't represent every single program or service right now with those 110 care partners, and we're looking for a variety. Sometimes when we get opportunities where, I just had one the other day that was looking for someone and we didn't have anyone on our roster that met that match. So tapping into a variety of programs and services. The other one is people who are haven't traditionally, from maybe marginalized communities where they have not felt safe to use their voice. We are building capacity to be able to support those folks in our care partnership program and just create a safe, welcoming, and warm environment. We work very closely with teams to be able to ensure that when we do that warm handoff, that they're ready and willing and able to support that person who maybe hasn't had the previous life experience of using their voice, or maybe is afraid of consequences. So, we are also looking for a variety of people of experiences and backgrounds, but in terms of, we're just looking for anyone who's willing to step up and say, yeah, I don't know what this is all about. I don't know how I can help. Wendy talked about her first journey. I don't know how my voice is going to make a difference. We just need them to have that first conversation, connect them to other care partners who have used their voice, and then we can get started. So my short answer is everyone.
Perfect. I'm actually going to come back to you, Jennifer. This question says, thank you for the inspiring and informative presentation. You've spoken a lot about lived experience from a patient perspective. Can you speak a little bit about the importance of involving family and/or friends as care partners? And how many of your recruited care partners are family members?
Oh, that's an excellent question. I would actually have to look at our roster list. We have, I would say, off the top of my head, I'm going to say we have a 50-50 split of patients and families. The value of families is so irreplaceable. And I say that because I think back to, we had a friend who, we had a care partner who was a friend to multiple people, and she was bringing people to multiple appointments. And during the pandemic, when we had to redesign our waiting room spaces, we brought her in to actually look at how we were designing. And she said, how am I supposed to meet my person who's coming out of the clinic way over there, and I'm in a waiting room way down the hall, and I don't know how I'm going to receive that information. And just her perspective of bringing people in was amazing. We've also seen through Care Transition Works, and people can answer this, about the fear and the hesitation that family members have of, how am I going to bring my loved one home? Do I have all the support and resources? We talked about Carers Day being yesterday, and I heard a statistic recently that said if all caregivers took a week off, our entire health system would collapse. They are a huge support to the care that we are providing together, and we need to be able to support their experience to be able to support patients in our care, and we need to hear their experiences, ask how they are doing, what supports do they need to be able to fill their bucket and provide support to the person that they're caring for. And again, you can see my passion and how excited I am about this, but they're a huge part of our healthcare system, and we need to lift them up, hear their story, and provide them resources and support.
Thanks so much, Jennifer. I think the last two are for you, and then I think we'll probably have to wrap this up, but this one looks like a shorter one, so we'll start with that. Are care partners being engaged?
I'm doing a time check, Renee. We're at 11:59.
Okay, we have one more question. Fine, I'll do this last one.
Yeah.
Are care partners being engaged outside of clinical programs?
Oh, yes, absolutely. You said short, but that's not going to be short. So I want to give props to a few. So dietary, our food nutritional services, a part of our Nourish project, foundation, they're working with a grateful patient program to look at fundraising. We've had pharmacy bringing, I know that's clinical, non-clinical, but in a way that looking at medication reconciliation in our ROP, looking at, we just got it from volunteer services about redesign from looking at the stores, for example, and just giving input. That's in early days, and Tracy's going to slap my hand for even mentioning that because she only brought it to me yesterday. There are, if you're clinical or non-clinical, absolutely, there's opportunity for patients and families to get involved with your program and service to give insight. And space program redesign, our cafeterias and our wayfinding, our signage, occupational health and safety is also reaching out. So I can go on and on. I had to be short. It's 1 o'clock, but yes, absolutely.
Awesome.
Opportunity for everybody.
Thanks so much. Okay, so we are going to wrap it up. I am going to pass it over to Roy. He has a few closing remarks very quickly, I'm sure. But I did just want to let you know that this session is being recorded and it will be posted to the intranet by the end of the day. So if you have colleagues who were unable to attend, or you feel like there was some great information that you want them to see, they're able to watch this later. And also the attendees today will receive an email with a request to complete a huddle evaluation form. And there's also going to be a link to that form in the chat. So filling that out and sending it back to us in communications by April 14th will automatically enter you in a draw to one of 3 downtown dollar gift cards worth $25. And back to you, Roy, and thanks for joining everybody.
Thanks, everyone. I know we're a little over time, so I'll be brief. Thank you, Patricia, Jennifer, Renee, for facilitating. I want to give a special shout out and thank you to Wendy for your presenting today. Inspired was the word I typed in, and clearly it was the majority of how people felt after the analogy of your friend's artwork with your brain fog was like vivid, and the use of your own imagery in your presentation. I don't know if I got this right, but the velvet textured flow of love. I love that. And just sort of how articulate that is. And I'm glad you decided, which is absolutely the case, the letters after your name don't matter in this work, your voice matters. And so thank you for stepping forward for all you continue to do for the healthcare system. We've heard lots of examples of how to incorporate kind of this untapped knowledge and experience of our patients, residents, and how that has to, brings light to issues and opportunities for how we change our healthcare services. So I encourage all of you listening today to think of ways you can continue to engage and partner with our patient residents and family caregivers. Reach out to the Care Partnership Office if you have any questions, and thank you for tuning in today. Have a great rest of the afternoon, and thanks for all you do.
Thanks, everyone.